Chelsea was the place in Massachusetts that was hit hardest by COVID, both from a health standpoint and from an economic standpoint. Because Chelsea is a population of largely Latin American immigrants, workers from Chelsea were concentrated in exactly the sectors of the economy that shut down. They just literally had zero income, and the only way they were able to survive was the city set up a massive food relief effort. That it didn't really make a lot of sense to tie up the public works department shipping in boxes of food and distributing it. There are multiple grocery stores in Chelsea, and if you gave people cash, they could just go shop for themselves, and they might be able to get food that was a better fit. The city decided to shut down the food distribution effort and instead distribute cash. When the city decided to do this, they had enough funds to give the monthly payments to a little over 2,000 families a month, but 3,600 signed up. And so the city decided to allocate them by lottery to be fair. Once I heard that they were doing this, I knew we had a randomized evaluation, because you can compare the people who won the lottery to the ones who didn't. Most families who won the lottery got $400 a month. Individuals got $200 a month. So often when we're studying the impacts of U.S. safety net programs, you're starting with people who are, let's say, getting $300 a month of SNAP, and what happens if you go from $300 to $350, but that doesn't tell you really what the value of the safety net is from sort of 0 to $300, where it's probably having its biggest effect. And because a lot of this population truly was not eligible for any of the U.S. safety net, looking at the effects of cash in that context gives you a sense of how important the safety net is overall. The main result was that the people who received the Chelsea Eats cards consumed more food, and in particular, they consumed healthier food like fruit and vegetables, like fresh meat and fresh seafood. The control group in this study was consuming a shockingly insufficient amount of calories, about 1,350 calories a day. The treatment group was consuming a bit over 1,500 calories a day, so the intervention closed about a third of the calorie gap. Another finding was that the intervention improved people's financial situation. The percentage of people who said they were better off than 6 months ago, they could pay their utility bills, if they had an emergency $400 expense, afford to pay that expense, improved for the treatment group.
The interesting thing about cash is it can do a lot of different things. The study that I led was to ask the question, what is the effect of cash transfers on healthcare utilization? And importantly, it decreased use of the emergency department by 27%, and it decreased visits to the emergency department related to behavioral health for depression, anxiety, suicidal ideation. And then we improved access to outpatient care, which is where we want people to get healthcare. By doing both improving access to healthcare and reducing visits to the emergency department, I think that's a win-win.
When you tell policymakers that you're thinking of doing a cash transfer program, you always hear two concerns. One is that people are going to spend the money irresponsibly, and the second is that they're going to stop working.
I think there's this narrative out there that cash transfers will increase use of drugs and alcohol, and I think we provide pretty compelling and rigorous evidence that that's not the case. It really dramatically reduced visits to the emergency department related to substance use disorder by 87%.
When we look at where people spent the Chelsea Eats cards, they overwhelmingly spent them at grocery stores and other places where food is the main thing being sold. And when we measured the differences in employment and hours worked between the treatment and control group, there wasn't any difference. I'd say the bottom line about this intervention was that it accomplished what the city set out to do. It enabled people to consume more food, but it also gave them the ability to spend money on other things if they had other important needs. You know, this both addressed the immediate need, but it also gave the families flexibility. If you're trying to help people who are struggling economically for some reason, it's fine to just give them cash and let them figure out what they want to spend money on. People who are low income basically spend money the same way everyone does. They figure out the greatest needs and they spend most of their money on that. We can just give people money and let them make their own decisions.